Hi everyone, welcome to This Week in Recovery. My name is Lindsay Cochran. I am a member of the Lackawanna Recovery Coalition, as well as a family counselor for a local treatment facility. Today with us we have Rene Esgro. How are you, Rene?
I'm good, Lindsay. How are you?
Good, thanks. Rene is the Case Management Unit Supervisor. Rene, if you don't mind just letting our viewers know a little bit about what your job entails and what you do for the counties.
Yes, Lindsay. I am, as you said, the Case Management Unit Supervisor for Lackawanna-Susquehanna Office of Drug and Alcohol Programs. I oversee 4 case managers in which our primary function is to assess individuals based on certain criteria and place them in the appropriate treatment program, assist with funding if necessary, follow them through treatment, and make sure that they are on the road to where they need to go.
And just to tail off of what you had said, Rene, if someone feels that they're struggling with substance use disorder or any kind of substance of any kind, what does the process look like in order for them to look into treatment options?
The process, Lindsay, would be for them to contact our office. A case manager is available at all times, and they would do a screening over the phone. Based on that screening, the individual will be placed in the appropriate treatment. If there's emergent needs that need to be met, it would be as soon as possible, or they may be scheduled for an evaluation.
And I know you had mentioned your case managers are available 24/7. Would you mind providing us with that hotline number for the viewers in case anyone is looking for that number?
Sure. Our hotline number is 570-840-8475. There is also a state hotline that is PA Get Help, in which individuals can contact that hotline and they will connect them to the county that they live in. So therefore, one of our case managers would be available to receive that call from PA Get Help. Our information is also available on the coalition website, in which anybody could get in touch with us at any time.
Great, thank you. And I know that you had mentioned part of the pre-screening process and the evaluation process is what determines what level of care someone may need to seek at that time. Would that include meeting the criteria for supervised detox?
Yes, it would include that. Our screening asks questions that would help us to determine if the person needs supervised detox or is eligible to have an evaluation. The questions on the screening pertain to the substance use, how long they've been using, what they're using, the route of administration, the person's age, their medical history. There's a lot of things that we take into consideration when determining that, and obviously concerns about overdoses and or withdrawal symptoms that could be severe. So based on our screening, we are able to determine if emergent needs are met.
Great. And then when we talk about different levels of care, would you mind talking about what treatment options are possibly available for the individuals?
Sure. There are several levels of care in which we also fund for those different levels of care through our agency if a person is eligible. We are contracted with providers anywhere from outpatient counseling to inpatient, halfway house, and MAT options, medical assisted treatment. We have provided providers that we contract with that offer that as well.
You had mentioned funding also. Is that something that insurance is needed for all of those options?
Yes, insurance is needed. When an individual calls, if they have private insurance, we ask that they work with us to contact the insurance company and see if there is any type of substance use disorder benefits. If there is, then we work with them to determine if there is a deductible or if there's a copay. Most individuals that we deal with are uninsured or underinsured, so our office is able to assist with funding, and medical assistance clients are able to go to treatment with their medical assistants. We assist with behavioral health, managed care, and are able to also access medical assistance for individuals that that don't have it at that time. If they're eligible, we will contact the county assistance office and assist with an MA application for them. And medical assistance does cover treatment.
Which is great. So it's good to know that yes, insurance is required, but in the case that someone doesn't have insurance, or maybe they have insurance, but say, the substance use aspect is not covered, there are other options that they can look into.
Yes, there are. And I think a lot of individuals are unaware of the services that we provide, and we are able to really help someone with finances rather than, someone going ahead and remortgaging their house, or some people don't know there's other options out there. And that's really, our office is a place that people can call and get help.
I would agree. And working in the field myself, I think that's one of the bigger questions that we see is that, my son or my daughter doesn't have insurance. They can't go to treatment, not knowing what other options are available. So I think to put that out there and know that there are funding options available, whether someone has insurance or not, and even just the services to be able to help someone with getting an application out there to be able to obtain insurance in the process.
Yes, we're able to expedite that process based on the need for treatment. And it really is a benefit to the client to have the insurance as well. People with substance use disorders don't always have the time to go and apply for medical assistance, nor do they think of doing that at the time during their use. So they really are eligible for a lot of the benefits, but just can't get there. There's a lot of obstacles to applying for medical assistance. And so if someone's actively using, then we really try and take that opportunity to apply for benefits for them.
Which is great, because I think, when you look at what treatment options are available and you talk about different levels of care, from detox residential treatment at a level 3 care, all the way down to outpatient or MAT, like you had mentioned, looking at the insurance aspect, because there's always a recommendation for some type of continuing care or aftercare. So to be able to have that to keep the process going, because as we know, it's not just a one-stop shop where in the past a 28-day program was looked at as being sufficient. That's no longer the case. No. And the research is out there to show that the longer someone is able to engage in some kind of ongoing care, the higher the success rates are to maintain their sobriety.
Correct. Our office actually offers case management services. Our case managers follow the individual from the beginning, doing a screening, evaluation, placement, and then continue to follow them through their different levels of care. Then they're available to also do case management services for individuals that may need assistance with housing or legal issues. So maybe financial issues, whatever it may be, life skills, placement in certain housing. So we are there to assist with that as well. I think that, as you said, it's not a one size fits all. And I'm glad that we are looking at individualized care for individuals right now, because it just makes sense to look at the individual's needs and offer the treatment that's most appropriate, but follow up with them and keep them on the road to recovery.
Yeah, I would definitely agree. And you had mentioned, having individualized care. And I think when you look at treating an individual and all of the aspects that come with that, because it's never just the mental health component, it's never just the substance use component, because either one or both of those things affect all these different areas in someone's life. And I think if we could look at having a treatment team and a case management team to be able to help, because not being able to focus on those different aspects can be an obstacle to someone facing, especially in early recovery. So to be able to look at that not being a barrier and something that we can work through and overcome, or look at solutions, possibly to resolve some of those concerns, can definitely take some stress off of the individual.
Absolutely. Absolutely. And there is, there are several programs out there that are wonderful for aftercare as far as certain recovery programs and recovery homes that will try to connect people with certified recovery specialists to have that as a service offered, along with possibly outpatient counseling if they were inpatient. There's really a change in what's being offered to individuals, because it isn't just one inpatient treatment and then done. It's really what happens after they get out of treatment that's so important. And if they can continue with support and other systems being involved, like you said, if they have a mental health problem, it needs to be addressed. It needs to, if they have medical issues that are a barrier to them going inpatient, well, we need to address how we're going to assist them with treatment based on those needs also.
I definitely agree. And I think it's important, not even just for the individuals struggling with the substance use disorder, but as we know, addiction is a family disease. So being able to have their family, significant others, or their children know how this process works as well, because a lot of times, sometimes the families are the ones who are looking into treatment options and seeing what's available for their loved one, not really knowing, you know, what this process entails, or that it is ongoing, or what's going to happen when they leave. So to know that there are resources available, not just to the individual, but to the families as well, that this is something that's ongoing, but there are resources available to cover all of these different aspects for everyone.
That's true. And family is a huge part of the recovery process, as you said. And we usually, you know, have families initiating the need for someone to go into treatment. So, you know, we deal with that on a regular basis and try to keep them informed of what's going on, because we realize so many people have no idea where to begin in the with treatment, where to go, what to look for. Every treatment program has certain specialties. So if someone is dealing with maybe post-traumatic stress disorder, or who has some mental health issues, they may be appropriate for a co-occurring program. And, you know, if someone is established, has a family, maybe is suffering from an OUD, they might be more appropriate for an MAT program, where they don't have to uproot everything. They could, you know, continue to be a provider for their family, as well as going to treatment on their own.
Absolutely. And I know we had talked about the individual, we had talked about the families, but I know there are certain cases where there are, you know, treatment courts involved, or the court system in general. What kind of a role do the court systems play in getting someone into treatment?
Well, I think that they really make a huge difference in someone's recovery. If somebody is involved in the legal system and they are eligible for any of the helping courts, I think that it offers them the ability to have structure and support. It assists them with getting into treatment, which I know a lot of times people don't know where to begin. So the courts actually have the connection with us. That's what the majority of our referrals are. We do assessments at the jail, as well as assessments for all the helping courts. So I think that they really are there to support these individuals and give them the guidance that they need to start on the road to recovery.
And just as you had mentioned, with your specific program, there's a case management piece. With the court systems, there's also a case management piece, whether that be probation or parole, or having these other entities involved, where they continue to monitor and keep tabs on the entire process. In the case that something should arise in the process, they're there to target that and be able to treat that as it comes up as well, right?
Right. Yes, we have a really good working relationship with probation, whether it's county or federal, state probation. We are able to assess an individual or try and place them immediately if there is maybe a positive drug test, or if someone is on the verge of relapse, or someone is not following through with what they need to. Probation will contact us and we will assess them immediately and try and get them the help they need, rather than being incarcerated.
which I think is also great to look at, because when you talk about the recovery process and being able to look at the different obstacles and things that come up in the process, sometimes it's obstacles that you don't necessarily plan or prep for, right? So to have, that support network there, and I know, we had talked about the importance of having, a treatment team essentially, and I think having that support network there, because sometimes those obstacles, especially in early recovery, can be so overwhelming and add all this pressure onto the individual. And you talked about relapse. That could definitely be something that can potentially trigger relapse. So that's something that I think as a whole we like to avoid if we can.
Absolutely. I think that the different support systems that are involved with the treatment courts and helping courts are so important to that person's maintaining that abstinence during the earlier stages in recovery. That's the toughest time. They're a lot of times coming out of treatment and are now facing reality, fines, court costs, family issues, a lot of things, all of the debris that was left from prior to going into treatment. So their work really begins there, and they really need the support at that point more than ever.
Yeah, I would definitely agree. As someone who has worked in the field for as many years as you have, what do you think are the keys to someone maintaining long-term sobriety?
That's a tough one. Everyone is unique. Everyone is has their own set of circumstances. I have, over the years since 1989, I've been in this field, have seen so many people succeed, and other people that just have continued to need to go through treatment. I think, in my belief, one of the things that are a key element to long-term recovery is the need to recognize and want to have a better life. I think if someone can really get honest and they have that need to have that in their lives and to know that they can have a better life, that it's there. I believe that it's something that we need to address with individuals. If they can try and just get a little bit honest in the beginning to acknowledge that they have a problem, obviously, number one, and number two, that they can have a better life in recovery. And to continue that, I think support, structure, employment, so many different things that can give back to the individual is what's really important in them maintaining that. I think the fact that they have I think the fact that they are able to feel like productive members of society and be parents and be moms and dads, and the longer they're in recovery, I believe the longer they want to stay in recovery, the more they want to stay in recovery. So I think that, just that want and to know that they can have a better life is so important.
I definitely agree. And I think if you look at, and I say this all the time, that I don't necessarily focus on what it is that brings somebody into treatment initially, right? Because sometimes it's, well, they're mandated, or my probation officer gave me the ultimatum, my wife threatened to leave me if I don't seek treatment, whatever the case is. But I think even if you come in externally motivated, if during that process we could build on that internal motivation, which is exactly what you had shared, you can see that the honest desire and the willingness to really see what the recovery life has to offer. Because whether, like you had mentioned, it's to be a parent, it's to be, an employee, or to go back to school, or to better myself and find a career that I love, whatever that might be. And I know we are so used to that instant gratification, but if someone can trust the process and have those supports there to help on the days that are maybe not so easy to push through, to see that in the long run, the benefits are definitely worth putting the work into the program.
Absolutely. Absolutely. I agree with you. I think that once an individual feels that they are at a point and they think early recovery is difficult, and if they can get past that and they're able to get the benefits of recovery and to give back to the programs as well. I think that is a big thing for people in long-term recovery, is that they are there to assist other individuals. And I think that is something that continues to assist them in staying sober.
I definitely agree. If you're able to just provide that 24-hour hotline number again for the viewers, just in case anyone is seeking treatment or may know someone who may need to seek treatment.
Absolutely. Our hotline number is 570-840-8475.
Thank you so much, Renee.
Thank you, Lindsay. Thanks for having me.
Thank you, everyone, for joining us on This Week in Recovery, and thank you again to Renee for joining us today as well. We look forward to seeing you guys next time.